Before beginning any procedure, check your facility's policies. Gather the equipment needed for an NG tube insertion. The NG tube itself, water-soluble lubricating jelly, a tongue blade, pen light, cath-tip syringe, stethoscope, 1-inch wide tape that's hypoallergenic or have an NG tube fixator device available, safety pin and rubber band for attaching to the patient gown, a clamp, drainage bag, or suction setup depending on the NG order, an emesis basin, a glass of water with a straw, clean disposable gloves, and a pH test strip. The best practice currently is to check gastric pH for placement. Check physician's orders. And wash your hands. Introduce yourself to the client, check her ID band and allergy band. Explain the procedure. Place the patient in a high Fowler's position if possible and assess for comfort. Choose the type and size of the stomach tube depending on use. Stand on the side of the patient with your dominant hand. Measure the distance to insert the tube, measuring from the tip of the nose to the earlobe to the xiphoid process. Mark the tube at this measurement. Place a towel over the client's chest and give her a tissue. Instruct her to relax and breathe normally while occluding one nare at a time. Select the nostril with the best airflow. Check the client's gag reflex. To decrease the tube stiffness, curve the tube tightly around the index finger and then release. Lubricate 3 to 4 inches of the distal end with a water-soluble lubricant. Tell the client insertion will begin and ask the client to extend his neck back against the pillow. Insert the tube slowly through the nare with curved end pointing downward. Continue to insert along the floor of nasal passage, aiming down toward opposite ear. If resistance is met, apply gentle downward pressure to advance the tube. Do not force past the resistance. If client begins to gag, withdraw the tube slightly. Check the back of the throat. If tube is coiled, withdraw it until the tip of the catheter can be seen. With the tube just above the oropharynx, instruct the client to flex the head forward and swallow small sips of water. Advance the tube 1 to 2 inches with each swallow. Advance until the mark is reached. Check for NG tube placement by following the facility's policy. An X-ray should be obtained to verify placement before any feedings or medications in the tube. Draw up 30 mL of air into a catheter tip syringe and attach to the end of tube. Flush it with 30 mL of air before aspirating, and while flushing, listen for air movement in the stomach. Aspirate gently back to obtain gastric contents and observe for color. Secure the tube with the nose, with tape or commercially prepared tube holder. If NG placement is for suction, remove the syringe from the free end of the tube, connect to suction, set the machine on the type of suction and pressure as prescribed in the orders. Fasten rubber band to the end of NG tube in a slip knot and pin the rubber band to the client's gown. Allow enough slack for movement of his head. Best practice is to test the pH of aspirated contents to verify placement. The pH should be below 6 for a gastric placement. Document the reason for the tube insertion, the type and size of tube, the nature and amount of aspirate, the type of suction and pressure setting if for suction, the nature and amount of drainage, and the effectiveness of the intervention.